With more people struggling with anxiety disorder than ever before, sorting anxiety facts from anxiety myths, or even dangerous cures, can be very difficult. In this video, we'll go through 7 things that people often get wrong about anxiety. Myth 1. Anxiety will go away on its own. For many of us, anxiety shows up like an unwelcome guest at the door. We can try to ignore it and hope it goes away on its own, but it keeps ringing the doorbell, getting louder and louder. Once inside, it takes over our home, it tells us what to do, it embarrasses us in front of others, it robs us of quality time with friends and family, it tries to stop us from leaving the house and makes us miss important events. Anxiety is persistent and generally worsens over time. Hoping that it will get better on its own and putting off seeking help is dangerous to our health. It's important to address anxiety and treat it with the same importance as a physical illness. Myth 2. Anxiety disorder isn't real. Although anxiety disorder can't be seen like a broken bone on an X-ray image, it's still a real condition, diagnosable under the Diagnostic and Statistical Manual for Mental Health. Anxiety disorder is not the same as feeling worried, like before giving a presentation, which is perfectly normal and can be helpful for anticipating potential problems. It involves excessive worry that persists for at least 6 months and impairs everyday functioning. Anxiety disorder is often accompanied by physical symptoms, including chest tightness or shortness of breath, a racing heartbeat, digestive issues, muscle tension, headaches, difficulty falling asleep, and many others. Myth 3. Medication is the only way to manage anxiety. Although medication is one option for managing anxiety and provides relief for many people, there are effective alternatives, and the best results come from a combination of treatments, including talking therapies like cognitive behavioral therapy, which helps us to make sense of anxiety by breaking it down to our thoughts, feelings, and behaviors. Meditation and relaxation techniques, which can help us to feel calm and grounded in the present moment. Focusing on what we can change instead of problems that are beyond our control. And exercise, which helps to reduce muscle tension and increases anti-anxiety neurochemicals like serotonin. The best approach for any individual will depend on the type and severity of anxiety, their personal background and preferences. As such, advice about treatment should always be sought from a mental health professional. Myth 4. It's obvious that someone has an anxiety disorder. When you think of an anxious person, what comes to mind? Perhaps someone tense with furrowed eyebrows and a distant look in their eyes. Although anxiety is very difficult for those who experience it, it's not always noticeable to other people. This doesn't mean that someone isn't struggling with anxiety and may be due to a range of reasons. They may feel ashamed or embarrassed of their anxious behaviours and work hard to mask them. They may be using coping strategies such as breathing techniques to manage their anxiety and avoid drawing attention to themselves. They may avoid situations that trigger their anxiety. While masking or avoidance feels helpful in the short term, it can be emotionally and physically exhausting and make anxiety worse or more difficult to manage over time. Myth 5. Anxiety disorders are uncommon. Globally, it's estimated that around 300 million people are living with an anxiety disorder. That's around 5% of the world population. Despite being common, anxiety is not always discussed in public, perhaps due to fears of embarrassment and social stigma. Women and younger people are slightly more likely to have some form of anxiety. There are many different types of anxiety disorder with different presentations, including social anxiety disorder, generalized anxiety disorder, post-traumatic stress disorder, to name a few. Myth 6. Alcohol is a good anxiety solution. At first, alcohol is helpful, miraculously reducing anxiety. It does this by dampening activity in the brain, but to keep pulling off this trick, the brain requires a regular supply of alcohol. If we suddenly stop drinking, the anxiety will return, often worse than before. Self-medicating with alcohol or recreational drugs can be a problem among people with anxiety, and a short amount of time can result in a dangerous addiction on top of an anxiety disorder. Myth 7. Anxiety is dangerous. Although anxiety and panic attacks can make you feel like you're about to faint, have a heart attack, or even die, this overwhelming sensation is temporary and not dangerous. However, over time, anxiety can lead to chronic stress and affect your health. so it's important to learn ways to manage anxiety. Have you come across these or any other myths about anxiety? If so, please let me know in the comments below.